I'm a consultant dermatologist. My name is Pick-Ngor Woo. Well, when I was little, I used to have to go to see doctors when we were ill, and I was inspired by the doctors I saw make me better. I think that's what I wanted to do, to make people better, basically. And why did I choose dermatology? I was very fortunate to have um, studied in University of Glasgow. People were very friendly there, and I had to attend. We had an opportunity to attend quite a lot of outpatient clinics in the dermatology department in University of Glasgow as a medical student, which doesn't happen in all medical studies those days. So we had an excellent dermatology unit led by Professor Rona Mackay, a well-known melanoma expert at the time. And the whole department, we had lots of teachings and seeing lots of patients in outpatient. It was very inspiring, and I was very interested in dermatology from then on. And then a few years later, when I was doing my medical rotation, I again very lucky to have worked in a rotation where I had to do 6 months dermatology. And it was such a nice experience that able to expose me to lots of different acute and chronic skin conditions. And the teacher and also the consultant dermatologist in the department really inspired me to do dermatology. So after that, I just decided to specialize in dermatology. I'm very lucky to get into dermatology, which I really enjoy and love. The most rewarding part of my job, no doubt, is to be able to help patients. When patients get better, really, it's a reward. So sometimes the job can be very busy. However, when you know that patients are going through a difficult time and you manage to help them, I think that is the most rewarding part of it. One example is a young boy, 7-year-old, with lifelong eczema from pretty much from birth. And he has been seeing a GP for all this time and given lots of topical treatments, and he really his eczema is really not very well controlled. So he couldn't sleep, he couldn't focus in school, exams results were bad, and the parents were always running around him, ignoring the other siblings because of his badly controlled eczema. So it can affect people's life quite a lot with skin conditions. This is an example. So when I saw him when he was 7-year-old, because he changed GP, he was being referred. Within a few days, I tried to optimize the treatment for this young boy with strong steroid and different treatment and counseling the parents and the child. My goodness, the skin completely cleared within a few days, and the child is able to sleep, the parents are able to have a good night sleep themselves, and he's able to focus. He's no longer tantrum throwing. The other siblings manage to get attention from the parents, and the teachers are really surprised that he is able to focus, and since then he was doing well in his exams. A completely changed, well-behaved young boy. Her parents really couldn't be more grateful that they have got the little boy back. You know, they thought that, oh, he's just a problem. They see him as a problem, but he really wasn't a problem. It's just a skin condition make him miserable and you know, not able to focus in anything. So just this is an example that I remember, but there are quite a few examples I can tell you. Basically, skin condition can cause so much psychological damage or long-term problem. It can affect self-esteem and affect people's life and job aspects, and also relationship in a lot of the time. So to be able to help them to clear the skin, it kind of help them the whole family and long-term prospect, life in general. So that's really rewarding. So I got a letter from this parents this little boy's parents just to be so grateful for giving them the little boy back. So that really makes me felt so happy and touched that I just feel like even a difficult day at work makes it worthwhile after knowing that I have helped somebody, to be honest.